Hello and welcome to this presentation which is looking at overcoming the numerical fear factor. My name's Michelle and I'm a SNAP Lead eTutor. If you'd like to get in touch with us or to make a tutorial booking, you can email us on tuition@snap-services.org. So before we start looking at the numerical fear factor then, it's perhaps relevant to consider for a moment why nursing numeracy tests are so important. You may have experienced general numeracy tests as part of a pre-entry requirement when applying for a nursing degree course. And that's to ensure that applicants all meet a minimum standard of numeracy. As an undergraduate or a qualified member of staff, you'll be aware that clinical drug calculations errors can have serious consequences for both patient and in turn medical staff. Given this then, numerical competence is an extremely important part of your day-to-day role. What can you do then to help yourself in terms of a numeracy test? Well, strong preparation is key, and giving your best performance is really down to effective preparation in two areas. Firstly, maths-based preparation, and secondly what we've called here mind and body-based preparation. You may have heard in the past phrases such as poor preparation often leads to poor performance. And for many people when faced with a numeracy test, this is certainly true. So in terms of maths-based preparation, then what can you do to help yourself? Well, it really does come down to lots of practice. So on the SNAP website, we have a huge bank of clinical and general numeracy questions, and you can access those via the assessment simulator and use the simulator to generate your own assessments, and you can self-test yourself on those with the system marking them for you. Also on our website we've got a number of general and clinical numeracy videos which highlight key tips when tackling certain types of calculation, so it's useful to have a look at those. Another good source of question practice can be past papers, and your course tutor or course lead may be able to help you access those. If you are feeling that you'd like some extra help, then you can book in for a SNAP e-tutorial using the SNAP website or via the email shown here. Just to talk for a few moments then about the SNAP tutorial service. What do we offer? Well, we offer e-tutorials, which is essentially an internet-based session with an experienced tutor like myself. We're used to working with students who struggle. We're friendly and patient and quick to build a rapport with you. A key thing that we try to do is to offer you different ways of tackling a question. So if in the past you've been shown a conventional method but find that difficult to get to grips with, then we'll try and show you a different way of tackling those particular types of question. Our sessions last around an hour, and the focus is very much on your areas of concern, which may be specific areas of general numeracy, or there may be particular types of clinical question that cause you problems. We offer a mixture of daytime, evening and weekend tutorials, and as at May 2016, the tutorial service is provided free of charge to students. From our experience with the tutorial service, we have identified certain areas of difficulty that many students experience. More often than not, students describe feelings of anxiety or panic. So students tell us that sometimes they look at a question, they simply don't know what to do, that they are then forced to rush straight into the question, performing calculations perhaps that they don't really understand, or that they make silly mistakes and don't want to or don't have enough time to check their answers. Quite often these feelings of panic are accompanied by something here that I've described as question fog. And what we mean by that is the feeling that you get when you read a question and simply don't have an idea of where to start with it. At that point, panic sets in and you start to perform perhaps calculations, but you're not really sure where you're going with them, you're not really sure what sort of answer you're looking for, and everything feels quite random and you're not feeling very confident about what you're doing. Going along with this, what we found is that many students rely too heavily on their brain in terms of mental arithmetic, rather than using their pen and paper to make workings, to write workings or jottings, so that they can see exactly where they are in the calculation, and also by writing things down, quite often that helps you to identify simple mistakes that you may otherwise make if you're trying to do everything in your head. Another area of concern that we've identified with students is what we've called here core needs, and that's really outside of maths and more general, looking at things like how well have you prepared your mind and your body, so in terms of sleep, eating, etc., for the actual test day. And that all goes on before the actual test day itself rather than during the test. So then we're going to look for a few minutes now about how we might tackle questions, and here we're very much focusing on a clinical question. The method that we've identified that works for many of our students is shown here, and it is a 6-step method. First step, very obvious, read the whole question. Now, the whole question, we mean exactly that. So if some information is shown in a separate box or a separate table, it is important that you do look at that as you first go through the question. Second step then, sounds very monotonous, but we're saying here read it again. And the reason for that is that on the second read through, we want you to use your pen and to let your eyes help your brain. So what we're saying here really is what we want you to do on the second read through is to try and pick out key pieces of information that you may need. As part of this second read through, we want you to think about what type of answer is needed. And quite often, the wording in a question, it will give you quite a strong hint as to the type of answer that you need to come up with. It also sometimes gives you a strong hint about the type of calculation that you need. So we're saying here, think about the calculation. It's not then until you get to step 5 where we're saying you need to perform the calculation. So steps 1 to 4 are all about preparation and understanding, and it's not until step 5 that you start to look at the numbers in more detail. The final step then, having completed the calculation, is to challenge yourself as to whether you can logic check your answer. The point of this is to try and eliminate those silly mistakes that sometimes happen just when you're performing a calculation. If you can look back at the original information and use that to check whether your answer looks sensible, then that can avoid you making one of those silly mistakes. Okay then, just to show you this method in practice then, looking at this clinical question. It says here we need to give 75 mg of amitriptyline hydrochloride PO as an elixir. The solution available is 50 mg per 5 ml, and we're asked about the volume we need to administer. So on the second read through then, we need to highlight the information that may be relevant. And you can see here with the highlighting that I've done that what that does hopefully is to very much focus your eyes and therefore your brain on these key pieces of information rather than everything that's written into the question. So we're saying here that we need to give 75 mg. What's available to us is 50 mg per 5 ml, and it's asking us about the volume. So in terms of step 3 and 4, thinking about the type of answer that's needed and the type of calculation, then what we're really looking at here is a volume question, so our answer needs to be in millilitres. So when we come to perform the calculation, we're thinking about the volume formula that many of you may be familiar with. So it's what we want divided by what we've got times the volume it comes in. We can then go back to the question and pull out the relevant numbers. So in this case, what we need for our patient is 75 mg. What's available to us is 50 mg, and that comes in 5 ml here. If we calculate that out, we come up with the answer of 7.5 ml. If you need help with the method or you need help with the final calculation, the tutorial with Snap can help you with that. Okay then, in terms of the other area of preparation that we've mentioned, mind and body based preparation, this is all about thinking ahead in advance of the actual test day. So it's about organising and checking the test and travel arrangements. So how are you going to get there? What are the arrangements on the day with regard to the test? How long is the test going to last? Are there any specific requirements for the test? For example, do you need to take your own calculator? Are you allowed a calculator? What sort of calculator are you allowed? And also then other things like making sure that you eat and drink well, as in terms of water, well before the test day itself. If you're well hydrated, then experience tells us that your brain will work more effectively. You also need to make sure you get enough sleep. Now clearly in the night before the test, and maybe on the morning itself, you may not feel like eating very much, so it is important that you think about things like your meal and your sleep for a couple of days before the test itself. In terms of the day of the test itself then, well, please allow yourself extra time just in case there are any last minute hitches. When you're in the test itself, if you start to feel a little bit panicky or a bit anxious, then use your breathing. And what I mean here is deep breathing. So in through your mouth, out through your nose, or in through your nose, out through your mouth, however it works for you. If you try and do that very slowly and deliberately, say 10 or 15 times, you may find that helps to calm your nerves. Another key thing to remember is that it doesn't matter what any of the other candidates are doing during your test. You need to ignore the distractions and make sure you use the full amount of time available to you. So if other people are finishing early and sitting twiddling their thumbs, don't be doing that yourself. Use the time available to go back and check perhaps the questions that you were a little less certain of, and once you've done that, actually go through the whole paper and recheck what you've got. Please remember that the services Snap offers are here to help you. We've detailed here our website address, the address of our main office, who have a wealth of information and can provide you with Snap logins, tell you about the tutorial service, and also the email address that you can use with specific tutorial queries or if you'd like to book in. Last of all then, good luck.